As she says now, that always scares me. So good evening. My name is King Navasa. I am the I said project volunteer. I am the operations coordinator for Black Beetle Health. And we are having a panel discussion tonight regarding mental health access in the 1 second, mental health, well-being, and communities of care. Are these barriers to people of color access? Are there barriers to people of color accessing mental health support? So with me tonight, we have a panel consisting of Sowmya, Sarah Grant, Harvey, and our new mental health officer, Kitty Felix Smith. I'm going to hand over to Kitty now to give us a proper introduction.
Thanks, King, and hi, everybody. Welcome to the event. It's nice to have you all here. Yeah, as King said, my name's Kitty. I'm the Mental Health Education and Resource Development Officer. My pronouns are she, they. And yeah, so today we're running this event because it was Mental Health Awareness Week earlier in the month. And I think today is specifically important to recognize the importance of talking about mental health, because yesterday was a year since the murder of George Floyd. And I think for a lot of people, this has brought up lots of thoughts, lots of feelings. And firstly, it's a time for tribute and remembrance, but it's also a time for, I think, reflection over the past year, for Black Lives Matter, for the disproportionate impact of COVID on our communities. And I think for lots of people, you know, it was a very difficult time last year, and this might be bringing up a lot for a lot of people. So looking at the images and the videos that people have been seeing, or people were seeing during this time, it can become overwhelming. You know, it's consuming when it's all over social media and things like that. And these images, you know, they can be quite triggering for people. The conversations can be triggering. And I think that's because, you know, racism is a form of trauma. And we, as people of color, we still have to go about our lives when we experience this trauma. You know, we have to go to school, we have to go to work, we have to look after our families and go about our general daily routines. And that's a burden, I think, which people don't necessarily speak about enough. You know, it's really significant that it's a burden that we have to carry around, and it impacts our mental health. It impacts our mental health a lot. And often the way people are encouraged to behave around these times is to be resilient, I suppose. You know, being strong and resilient is seen as something which we want to aim for. And I think it's important to recognize that that's not always what we need to do. We also need to allow ourselves those spaces to speak about our mental health, time to reflect, time to speak with others. And I think that rather than necessarily trying to be strong or to be perceived as strong, you can see another kind of strength in talking about mental health, being vulnerable, and allowing yourself that vulnerability around other people. And particularly, you know, in the last year, as I was saying, there was Black Lives Matter, and with lockdowns and COVID for LGBTQ people, a lot of that has been being stuck in homes with maybe back home with your family, people who are homophobic, biphobic, transphobic. And then these people are discriminatory towards you. This is in your own space. And that combined with everything that was going on last year, you know, it's been just a difficult time for queer, trans, intersex, Black people and people of color. So the combination of these two parts of our identity is really important. And that's why right now it's, you know, it's particularly important to be having these conversations around mental health. Yeah, so I think we're going to look a bit more at the barriers to accessing mental health support for people of color, because, you know, we want to address that sometimes people don't access that support that they need. Disproportionately, people of color are less likely to access mental health support. So I think it's important to have conversations around those ideas.
So are we going to be looking into the barriers themselves? What do you mean when you say barrier?
Yeah, so by barriers, I think there's different kinds of barriers. There's things like social and cultural stigma, language barriers, previous negative experiences with mental health support or the medical community in general, a lack of mental health services which specifically aim towards people of color or LGBTQ and people of color, and then a lack of Black therapists or non-Black people of color therapists, therapists of color even, and things like not having a community of care because it's not really spoken about. Mental health isn't really spoken about within your culture.
So just carrying on from that, you just mentioned not having a community of care. So what do you mean by that? What is this community of care? I'll open up for everyone to jump in just a minute, but I'm picking on Kitty now.
I think communities of care, in this instance, I'm talking about having open spaces for talking about mental health, open spaces without fear of stigma or judgment. So kind of the conversations around mental health, you know, as we're doing today, so they can be in person or they can be virtual. And that is something which might be lacking in some cultures. You know, if mental health or mental health issues are seen as taboo, it's not something which is easily spoken about, it's stigmatized. And particularly for some cultures where there is things like your religious belief tells you that maybe your religion will get you through that issue. So it's taboo to speak about mental health issues. So it's not really, yeah, you don't have that community of care.
Okay. I'm wanting to pull in our other hosts, our other panelists, sorry. The on the concept of communities of care, is there anything that we can add into that to say, okay, do we have any examples of how someone can access, or sorry, what a healthy community of care, or what are the what am I trying to get at here? What does having a community of care essentially look like?
Something comes to my mind. I was recently in a presentation where they were talking about the social determinants of health. And, you know, typically there are things that people may readily think of, like transportation barriers being an issue to a person attaining the health care that they need, or health access. Do they have medical coverage, things like that. But when they talk about support systems, it's something that we don't readily think of as contributing to one's health, whether physical or mental. And that really stuck out to me. So they were asking questions like, did your parents tell you that you could do whatever you wanted to in life? Did you feel like you could achieve any sort of career path that you wanted? Things like that. And if people have different varying degrees of that social support and that that potential and things like that, that can affect how they seek help, how they seek care, how they feel about themselves as far as self-esteem and all of those things. So that's what came to my mind when I think about the implications of the community of care on a person's health outcomes. And it actually supports the idea of the complexity of the determinants of health.
Yeah, I totally agree. And I do want to jump back and just comment on something that Kitty said around, you know, what community means. And, you know, people who used to operate definitely in faith spaces where you were quite accustomed to that weekly or, you know, multiple times a week, that engagement with that community, a faith community. I think as an LGBT person of color, and, you know, you lose touch with those communities because it's no longer acceptable in those spaces. So who's your community then? You know, who are you leaning on to say, how was your week? You know, how are you getting on? In the context of, you know, previous context of like sort of church, people say, okay, just want to let you know I'm praying for you. Like, we don't, you know, that's not a practice that we see because it's just not a space that is still accessible to most LGBT people of color. And so you lose that community, you lose that check-in. You don't even realize it was a check-in, but you lose access to a check-in. So then what do? You've got to find a community of care. That's the answer.
Sorry, I didn't realize it was, I thought it was rhetorical for a second, so I didn't answer. But
yeah, no, I would just like to jump in on everything that everyone is saying. The whole concept of having a community, I think for me personally, my personal opinion is that I think it starts from home. So when you start providing a stable environment for your child, introducing any early childhood interventions that is required. I don't know how many parents speak to their children at a very young age, because they are exposed to a lot, more than we even know. They face bullying in school, and they have all of these identity crises after a point of time. And you want to be associated with this hep gang, the most popular gang in school, and all of that things happen, and you have so many things going on in your mind, kind of like trying to find out who you are, what your identity is, how do you identify as. And when all of this happens, and when people at home, your parents, or maybe like your siblings or your grandparents, whoever you live with, when they start at a point when the child thinks that they can open up to the parents, like at home, but they don't feel that safe, because the parent immediately shuts them down, saying that no, you can't speak about all of this, what are you even saying, so the child automatically thinks that okay, maybe I'm wrong. And then that is how I feel personally, is how they look out into the communities as well. It's like, okay, my own parents who know me from a very young age think of me like this. What are strangers outside going to do for me? How can I reach out to them for help? And that's where I think is the first barrier that they face, and they sort of like hold back.
So
um
what you're saying, just to jump in there, that lack of emotional support, or that emotional pillar from home, sort of adds that extra anxiety on top of it, saying, if I can't get this here, if I'm made to feel this way here, then like, if that my own mother won't give me this care, it's like,
yeah.
what am I gonna, how am I to expect my teacher to react, or
Mm,
this person at work, or
mm.
the pastor,
Yeah,
whatever your faith may be. But
yeah,
mm,
yeah. No, and also, like, from personal experience, um it's been so many years, and my parents know that I have mental health issues, but then they've chosen to ignore it, because
mm,
they don't want to see that. They don't want to think that, oh, because it automatically, they feel that it automatically is like a black mark on their parenting, but it
mm,
doesn't have anything to do with them. It has
mm,
to do with you. So from as a child, like, when I used to say things to my parents and say that I feel like this in school because they're bullying me, because I'm not as fair as they look. When things like that happen, they automatically shut you down, saying that no, 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 that's all fine, it's all in your head. So that's where, like, I found my first barrier there. Okay, fine, I can't talk to my parents about this now. If I go and say this to anyone else, even my teachers, they're going to laugh at me. I can't talk to my peers about it, because they are the ones who are bullying me. So it just keeps building up, and it takes a lot after a few years to sort of like see that, okay, apart from this, there are so many other barriers there. How am I going to cross all of that? How am I going to come out of all of that? You have, like, a lot of, like Kitty mentioned earlier, you have all of these, the environmental factors around, the financial barriers that you have, the social, the cultural barriers that you have. How am I going to surpass all of this and come? So I think, like, everything is interlinked, and you don't just have like one particular barrier that you can say, like, especially for people of color, especially for racial ethnic minorities. What do we do? So it's and especially when you're in a different country, they look at you differently. You're not from here, so they look at you differently, and then they think that, okay, fine, you know what, I understand your problem. But then you are like, no, wait, you don't understand my problem. You're white, you have that privilege, I don't. I've gone through more than what you have. How is it that you are able to understand my problem? So it's more of, for them, I just feel for them it's more of like this textbook things, that okay, my textbook says this. I've gone to, I've done psychology, my textbook says to do this, but then it's not always the same.
is this one of the cases where you would say then, it would, the care would have more effect if it came from someone, um I guess, that looked like you, similar background, so it essentially going to a non black or person of color kind of counselor, essentially trying to lean on them, and then having their validation just doesn't quite seem genuine, almost, because it's like, how can you even relate? So because essentially everything is so different, our realities are so different. So when having you say that having you, I guess, validate my trouble, like my concerns, or when I'm going to you for help, and it almost just feels like it's just textbook responses you're giving me, because it actually doesn't feel like you can relate, or I can relate to how you're offering the care. And throwing that back to Kitty, because that's what you did mention when you were talking about communities of care and getting help. You might that certain groups of people will want, for example, a trans therapist might want, a trans person might want an LGBT therapist, someone that they can actually relate to more, rather than someone not of the spectrum who would essentially, as Sowmya just said, give you textbook answers, just kind of go, yeah, right. So throwing that back at you, Kitty.
Yeah, definitely. I definitely agree with what Sowmya was saying. I think in my experience with the work that I've done, like the support work which I do, some of that is specifically directed towards queer, trans, intersex, Black and people of color communities. And something which I've heard a lot of is that there's just a lack of those services. They don't really exist that much. And it's having that space that is specifically directed towards people of color or LGBTQ people of color, it just makes a huge difference, because they feel like there's just an understanding, like a baseline understanding. If this person shares my identity, maybe they understand discrimination, they understand racism, homophobia, etc. So you can kind of communicate about that. And I think a big issue is that there is a lack of therapists of color, counselors of color. And I think this is kind of important around the idea of like cultural competence. So people don't really understand, your history, your traditions, your background, which means, I think lots of different things. For instance, if your therapist doesn't understand your cultural background, I think for some cultures that might mean something along the lines of, I think individualism versus collectivism. So in the West, we're quite individualistic. We sort of think about things, on our own, in like an individual sense. But a lot of places, that's not really the same thing. People think of their lives more collectively. So like how you go about your life is impacted by what your family thinks and what your family's values are. And in some cases, a white therapist might not really understand that. When you're having a conversation with your therapist, you've gone there to access mental health support for whatever reason. Maybe you don't want to have to explain that to that person. You don't want to have to explain your familial cultural dynamics to your therapist. You should just have that baseline understanding in the first place, because they're there to support you, and you don't need that extra burden of having to explain to them why it is that your family is so important, why you don't want to do something necessarily that's going to bring shame to your family or something along those lines, because you're there for the support. You're not there to educate this person. There are other people who would understand that, which is why I think it's important that there are therapists of color and Black therapists, and being able to find them as well. I suppose having that access in the first place is also really important, so people know where to go to find those individuals or those services.
Mm-hmm. So going further into the topic, I want to throw this at Sarah. And Sarah, you in particular have a background with chronic diseases. So I just want to ask you, even briefly, does having a chronic illness affect one's mental health, and what sort of, if any, extra barriers does that add to them accessing mental health support?
Yeah, good question. So there are a few different examples of how chronic disease can affect mental health. Oftentimes we may think of our physical health as separate to mental, and to Sowmya's point earlier, people may attribute, they may not understand the distinction between something that could be a chemical imbalance, which is physical, versus something that they may put as spiritual or other, there's place for all of that. But there's definitely things that are related to physical issues going on, hormonal imbalances, things like that, that display themselves as mental health issues. And that's why that there are certain medications that address those certain things. What are the levels like, the hormonal levels like, and can we correct those and help to stabilize the person's mental health, in addition to all of the behavioral counseling and things like that that go on. So yes, there are chronic conditions that manifest as mental health issues. There's also the effect that medications can have on a person's mood and hormones as well. For example, if people are taking certain medications like steroids or antidepressants that they use for other things that show up and have their own set of side effects. Sometimes medications can cause depression, anxiety, suicidal thoughts. You know, as a person who's worked in the pharmacy field before, unfortunately, sometimes it's like, you know, these medications cause a whole host of things. It's like, do you even want to take the medications at this point? So yeah, sometimes people have to kind of make that choice, like, do I want to take medications that are going to treat my chronic condition, but potentially have adverse effects as far as my mental health? You know, there's also that factor. Then there's the dynamic of just dealing with a chronic disease. When a person receives a diagnosis, it's a life-changing event. Of course, chronic implies that it's something that exists for a long period of time and is not cured, or it doesn't go away quickly. Therefore, they're looking with a life change, medication change, body changes, potentially changes on their potential to be able to work and things like that. So there's various dynamics that affect their mental state that can cause depression, anxiety, and a host of other things. So there's definitely that connection. Another dynamic is individuals who are in various communities that we've mentioned already. If they already have a fear, a hesitancy, or a mistrust of seeking for health professionals because they fear some sort of discrimination on various levels, that makes them less likely to seek these services. And so it compounds the issue, which may advance a mental health issue that could have been resolved earlier had they gone for treatment. So there's a few different dynamics I wanted to mention there.
Opening that up, if anyone wants to add more to what Sarah just shared.
Yeah, I was just topping the chats there, actually saying, you know, there's often a lack of overlap in what's sort of called you know, psychosomatics. So your brain and your body and how what you're thinking can affect how you're feeling, and how you're feeling can affect how you're thinking. And when they merge, if we have a conversation around what psychosomatics are doing, how your mind and your body interact and how they engage, it's a much broader conversation. Bringing it back to communities of care, though, as one solution alongside what Sarah's referring to, which is medication, which should not be frowned upon. They go hand in hand, but also looking at that therapy element. And responding to what Kitty was saying earlier on about your therapist, and also Sowmya saying how if your therapist does not understand your experience, it can be quite exhausting to have to then start like session 1 and session 2 consultation. We've all been there, where you have to first explain what the problem is, and that can be the most traumatic part of the entire experience, having to explain to someone who you already know, just based on how they're presenting in front of you, is unlikely to really truly understand the experience that you've had, and why you may be engaging with therapy, whether or not you're presenting with a problem or you're presenting just as a routine check-in to make sure that you're doing okay. Particularly if a therapist, and this is real life experience, you know, therapist goes, really, I've just never heard that. Oh, well, I'm so glad I was able to educate you today. You know, that can be quite like, if you're not the right person, that can be extremely distressing to think that a therapist, you know, is almost in a space to just to soak up the learnings for the next client. You're sort of thinking,
yeah.
when are we getting to my issue? When are we getting to the conversation around why I've come to you today? You know, and so it's really about being, you know, it's really true that, you know, we have people who have had similar lived experiences. That is a core consideration in you know, sort of alongside communities of care, alongside, you know, sort of medications that can be provided to help support mental health, and to really try and stabilize things when things are not going best. Sorry, I hope that wasn't triggering for anyone. But yeah, that's my personal experience. Yeah.
I can relate so much to it, because when you even said, okay, so when do we start talking about why we're doing this in the first place? For me, that's like 5 sessions in, and oh, by the way, I only have 10 sessions with you. I just had to I had to back it up so far and teach you these things so that you could follow and carry on. And I'm like, I felt it. It did trigger me a little bit. So passing it to Sowmya, actually. How adding to this lived experience that Harvey was touching on about the therapy, counseling there. Do you have anything to add to that? Because I know that previously you have described with me in a chat that you've accessed some services as well.
Yeah, yeah, no. So I think it was because I am not from here. I don't know how. I didn't know in the beginning how the health system worked here. So I was quite happy to know that, you know what, you can actually just give them a call and say that, you know what, you just want to go for talking therapy, you know. So you'll have a psychologist available for you, a therapist. I was so excited. I was like, okay, finally I can get the help that I wanted to. But no offense to anyone, I was disappointed. I was so disappointed because I couldn't choose who I wanted. You know, I specifically said I want a female therapist, uh, and it would help if it's someone, you know, South Asian, because they would understand my culture, like Kitty says, you know. But I didn't. I did get a female, but then I didn't get a South Asian, and they were white. And like Harvey said, first 3 sessions was me trying to explain my culture to them, saying that, you know, we live as a family, we are worried about what society says, you know, and we go about by that, and you know, we are very, very much united, and you know, all of that. And that was quite surprising to her. And then she's like, but why do you have to do all of this when they keep saying this? You can just leave them and come. I'm like, no, I can't leave them and come on. I mean, wait, but you know, it's, for me, so many times it was like, wait, you're going off topic now. This is not what I'm I'm here for. So it just generally, you know, it just got to me a lot. And it was sort of like more like, you know, wait, it looks as though I'm giving her a session than the opposite happening, you know. So
Yeah.
it became like that. And for me, it was just, I wanted to speak to someone, I just wanted to talk, and I want someone to listen to me without judgment, you know, and maybe offer me a solution, you know, to the problems that I'm going through. But they decided, they just decided that CBT was the right way to go about, which I know I didn't want to do. I didn't want to sit there and do exercises. I don't want you to give me homework, you know, to come back to you. I'm like, wait, no, this is not what I wanted. And I had, I think 12 or 13 sessions, and I'm like, wait, now I feel even more upset than I did before. Like my anxiety is actually increased more. This is not what I wanted. And then it it was after that, I just felt, you know what, I don't think I'll be doing this again. I don't think I'll be going for counseling again. I don't think I know I'll have to access therapists. And that just sort of held me back a lot. And I wasn't able to understand why these things were happening, you know. So and also another thing that I faced was a language barrier, because I don't know, in the beginning when I came here, people did find my accent different, and they were not able to understand my slang. And there were certain things when I used to say like very common words, and she was like, wait, well, what did you say? Sorry, I didn't understand that word. And then I'm like, oh, okay. Oh, you know, so it was just like, I did not look forward to the session. I did not look forward to, you know, being able to, you know, go back to her and saying that, you know what, you helped me a lot. Thank you so much for that. It didn't.
Right.
So it was just like this huge thing that happened. And for me, it was more of a cultural thing, and I didn't like it. I wasn't comfortable at all. And like Sarah said, I mean, you need to have that trust with them, especially when you're talking about your deepest, darkest fears and your secrets, and you just like trusting them so much. You're bearing your soul to them. I didn't get that trust at all. And because this is just my personal experience. I'm not like generalizing all of the therapists, but just what I faced. And it was, to an extent, was scarring, actually. So but now I have someone who is from India, who is like from the neighboring state, and it's so much easier when I just tell her something. She's like, yeah, I get that. So it's even more better. You are able to open up even more,
Mhm.
and you can just trust that person. So
So you've
I
had
think like there was like a lot happening there.
yeah, you
Yeah.
got both experiences, so you see the importance now for having a
Yes.
POC or someone from even a more familiar culture that can be more relatable in that conversation with you.
Yeah.
And
Yeah.
sorry, just to pass it to Sarah, you have your hand up there.
I have a question, and I
Mhm.
hope I'm not jumping ahead of the program, Kitty.
Mhm.
Just listening to all of the comments, it makes me want to ask, what do you think is the first priority for people, for the community, as far as advocating for these services to be tailored towards their needs, or for the practitioners to be tailored toward their needs? I ask that question because some people might say on one hand, okay, if you have a problem with the mainstream or the predominant population that's in these positions, create your own. And there's that camp that like we should have for ourselves, we should do for ourselves, which is completely justified. And then there's another camp that says we need to educate, we need to encourage cultural competence and compassion, understanding, and things like that. But then you kind of run into the risk, which you guys have already expressed, of, okay, but I might have to do a couple sessions of education before I can get into, like what should the community do first or primarily?
Well, I think Kitty mentioned that earlier on, and it was about cultural capital. And I don't know if that's where you were going to jump back in there, Kitty, and say that, but I would love to make that core to this conversation, definitely, because that is a common consideration. I was doing a presentation earlier on today where I was speaking about cultural wealth development and cultural capital within the context of socioeconomics. Do we have the means? Whilst we're being asked to go to therapy, go and engage, but do we have the means? Okay, whether that be financial, do we have the means interpersonally? Do we know how to communicate the needs that we have? Is there an expectation that we can just advocate for ourselves, or do we feel awkward about it? Cultural capital, I think, is definitely core to that conversation. Do we have the ability to? Are there enough of us? Are there enough of us? Okay, who specialize in things like CBT, like you mentioned in the chat, talk about sort of talking therapies. Do we specialize in that, and do we have the tact and skill to create comfortable spaces? Most of the POC sort of therapists that we reach out to signpost to, they're absolutely rammed. Off the back of BLM, rammed. There's no space on their timetable to actually signpost people. So we're actually having a bit of an issue with trying to find placements. And so it's really great to see work like the LGBT, Black LGBT Therapy Fund, I believe it is, just focusing their work solely on getting money to ensure that we have more places and we can pay for more people to actually have access. So yeah, just wanted to mention that.
Good mention. Kitty?
Yeah, I mean, I think that it's important, firstly, because yeah, I think you're right, there is a rift. There's one side saying that we should have our spaces ourselves, and there's the other side saying that we need to educate these people. They're there, they're trained, and they could give us support if they had more education. And I think that there's some truth in that, for sure, that maybe an answer is for the people who already have that training and the ability to go and give support to people. If they had that cultural capital that Harvey just mentioned, then that would be another route for giving that mental health support. And I think firstly, what's important is that, I guess, there's conversations between people. So like we're having this conversation today, we're talking about these things between the people, the organizations which already exist, like Black Beetle Health and other organizations which are specifically for people of color or LGBTQ people of color, where there's a space and there's a time for these groups and individuals to have a voice and to explain what the needs are and to explain within their timing, I suppose. So rather than, as I think Sowmya and Harvey both mentioned earlier, you get into those sessions and then you're kind of forced to explain yourself, but not in those situations. There's a time and a place for having those conversations and that education. So speaking to the organizations that have that knowledge already, I suppose, and just having like that open line of communication.
Okay. Bringing it back to the concept of communities of care. Kitty, what kind of alternative communities of care and well-being practices are there?
Alternative communities of care, I think, well, well-being practices, that could kind of be anything, you know, it's kind of around the ideas of like self-care. So that could be just taking time for yourself in a busy day, having time by yourself, reading, listening to music, exercising. The theme of Mental Health Awareness Week this year was nature, which I think is quite fitting because obviously we've all been, I don't know, a lot of people have spent more time in nature this year. Outside, we've all been outside,
we've all been
enjoying
outside.
the sun. We have been outside. You can't meet people indoors, so you're socializing outside. You know, you haven't seen somebody indoors in however many months. And we're all just out and about in the parks or walking around. So yeah, I think that's fitting. And I also think that communities of care, like I mentioned earlier, different groups and organizations which already exist. So if you maybe have that barrier where it's not really within the people who you mix with on a day-to-day, you know, it's not really a conversation around mental health support, you can find those organizations within your area that do have those conversations. There's lots of different groups around the country which kind of focus on those sorts of things. I think some of them are really, they're a really good way of having that community of care. Groups like, what have we got? I think in Manchester, there's Rainbow Noir. In Bristol, Kiki. Brighton has Radical Rhizomes. And then there's Hidayah. I think there's lots of them, you know, that you can get involved with if you want to meet people and speak to people and have that community of care with people who are people of color or LGBTQ people of color. And then you can kind of build those relationships. I think specifically with, you know, queer and trans people, a lot of the time we build our own families. You know, you maybe didn't have that as you were brought up, and you kind of create that space for yourself through building new relationships with people who share those identities with you. So I think that having those connections is a really good way of building yourself a community of care.
I love that. You did you drop that in there? Like, yeah, we do choose our families, don't we? Yeah. Harvey, I'd like to pull you into that discussion there.
Yeah, I'm actually doing a piece of work in the day as well that's focusing around particularly mental health for people living with disabilities. And what we're finding is that there's loads of information available for people who might present with physical disabilities, but maybe not so much for those who might identify as or be hearing impaired or be visually impaired. But one of the really important things that come up within that is social togetherness, connectivity, having that support, and that's what a community of care is. And so even in researching that, the same theme is coming up. Participants who responded to this survey have said that they really would have benefited from social togetherness, except when people might be experiencing things like anxiety or depression, they feel less able to engage with people, and so not being able to engage with people and to socialize means that they don't have that support system, which means that they're stuck in a mental health cycle or mental ill health cycle. And so it's really interesting to see that when we talk about things like disabilities, for example, you know, we do sort of can go, right, let me see if I can see this disability, but things are not always visible. And so we don't necessarily consider things that are going to be conducive to a wider range of disabilities. So one of the examples that they gave was around physical activities as one means of social togetherness, but they're not considering non-physical options of people who were sort of less mobile, or there was limitations to their movement. And so when you have that issue for a general population, and then you apply the next, the LGBT lens, and you apply the POC lens, or being someone from a racial sexual minority background, where we already know our communities are really small and we don't always get on in all spaces because the conversation, the vibe is different. What are you supposed to do? What are you supposed to do? That means that there's an acknowledgement that there is a lack of intervention for people with multiple intersections. And so, I think this is where we have to be focused on the small incremental changes to really think about the really small incremental changes, within the wider scheme of things that we could be doing, because it's not necessarily about what we should be doing, but what we can do. And it sort of helps us to manage our expectations around how we can sort of move toward communities of care and find the things that fit for us, regardless of how we might be limited.
Yes, sir. Thank you, Harvey. I thought I heard someone trying. Sarah, was it you trying to mention something earlier?
Yeah, just Kitty was speaking, I wanted to mention that, you know, people may experience the issue where maybe they don't know of those therapy services directly in their area, in their city, or things like that. So again, with the assumption that technology is available, people may even want to look into online therapy services, which may give them a little bit more reassurance because they don't necessarily have to be on screen if they don't want to, or if they do, they can. But you know, sometimes, you know, there are apps available even where people can just chat with a therapist or speak to them by phone. So that might give them a little bit more secure of a feeling if they, you know, don't want any kind of preconceived biases that come from how they may present.
Mhm. Thank you.
Yeah, just wanted to add to that, you know, but most often people don't sort of have the main goal of, you know, going to a therapist. You know, they just want to talk. They just want to talk to someone who's non-judgmental and, you know, who doesn't know you, you know. So it's just generally like they just feel okay. And then for those matters, I think you have a lot of like 24/7 services that's available where you can, you know, just talk to someone, and it just makes you feel good. It's helped me a few times, you know, we just want to talk about something really random, you know. So it's actually like helped a lot. And you know, you have in the UK you have services like Samaritans, which is solely a telephone service where you can just call them and just talk to someone, and they're available like 24/7. You have I think Shout, where you can, you know, text someone, like Sarah says, you know, people are not very comfortable speaking most of the time. You know, they feel like very sort of they get really conscious in front of a camera, in front of someone, you know, because you're just putting a face to that person. So it's really useful. So thank you, Sarah, for bringing that up as well.
Excellent. So I just wanted to say that the chat is open. If any of our guests have any questions, we have time to take to answer some questions on camera for you.
I just want to jump in as well and say, I think it's so powerful that even as practitioners, people who work in, you know, a variety of things within mental health, within sexual health, within the wider public health conversation. I think obviously Sarah works in diabetes care even, you know, and so it's really thinking about sharing our stories, you know, and really saying that even though we're on the caring end, we're on the giving end, that actually we're very much advocates for, you know, through our own personal experience of engaging with the right services. And we, you know, just because we are maybe practitioners, it doesn't make us exempt from those same experiences. You know, we are still faced with having to face the same barriers that everyone else faces, and we carry that weight. We carry that weight like anybody else would. But it really is a testament to humanness and being realistic, particularly during this time of lockdown and COVID and everything going on, that we've done a really good job, I think, as a team to just keep going. You know, people always drop me a little note and say, how's your team getting on? You know, because I know that you know, a lot of people have not been able to carry on, even though they'd be expected to. And you know, I think it's just due to being honest with oneself. So I really was really encouraged to hear other people's stories as well, because I wasn't even aware of that.
Thank you. Kitty, I'm going to ask you to tie this all together for us now. we've had a good panel discussion, but I want you to tie it all together for us.
Sure, yeah, thanks, King. I mean, firstly, just thanks to everyone. You know, thanks to all our panels, thanks to people who have come on to listen to us today. And I would say that like everything we've spoken about is pretty important. You know, there are different barriers, there are reasons why people of color may not be accessing mental health support. You know, there is a disparity there between people of color and their white counterparts in accessing the support services, but there are different things which we can do. You know, there are different community groups, like I was saying. There are spaces where you can try and find those therapists or counselors. like we have on the Black Beetle Health website, we have some directories for mental health services, which would be useful to look at. Also on the Black African Asian Therapist Network's website, you can kind of put in different genders and sexualities, as well as there's a list of people of therapists of color, which obviously is useful if you're trying to find somebody who's of your the same background as yourself. And I think a good takeaway is just, it's a conversation, and it's not necessarily something which you don't necessarily need to go away and feel like you have all the answers. It's something to think about, something to bring into the rest of your life if possible. There's just a little takeaway or something like that. Oh, and another directory which might be useful, I would say, the Black Trans Foundation is working on a QTPOC directory at the moment. I think that's coming out soonish, maybe next month, but I would say to keep an eye on that if you are interested in accessing a therapist. But yeah, just thank you for today, everybody.
All right, I have a question for you, Kitty. This question is coming from the audience. So why is it difficult to access community healthcare teams regarding mental health counseling in terms of longer responses?
Sorry, say that again, please, King.
Yeah, so the question is, why is it difficult to access community healthcare teams regarding mental health counseling? Pause and make sure I'm understanding the question myself.
So what's making it so difficult? It sounds like, so we talked about barriers earlier on, and we say that I think people are saying, oh, I'm not accessing a mental health service as much ease as maybe my white counterparts. Why is that? I think that's what the question is. Yeah, that's if I've misunderstood that, you can just jump back in the chats and tell me wrong. that's how I've heard it.
Yes, please make sure we're understanding the questions so we can give you a good answer. It was submitted to me directly, so I didn't want to name the person, you see. So,
sorry. Yeah, I mean, I think it's the kind of things which we were talking about earlier, that there are those barriers, I guess, by the things which we spoke about, the cultural influence, the social stigma, things like that, and the lack of support systems. And also, we kind of spoke about this earlier, I think, negative previous experiences with mental health support, like a few people mentioned going in and having to have those conversations. Once you've had that negative experience as well, I think that really stays with you sometimes, which can be, it takes a toll on you. And then the next time you're going to go and try and access that support, you're going to be thinking, well, this is what happened to me last time, and that could be, it doesn't necessarily have to be with mental health. I think that could be with another part of the medical community. I think with things like, for example, trans people, when they're trying to access services, there's often a lot of barriers for them if they're trying to access hormones or things like that. And then you want to go back into a different section of the medical community, and you're going to be thinking, what's going to happen to me? Am I going to experience more discrimination? Is there going to be more ignorance? And then there's going to be a barrier between you doing that and feeling like you are able to do so, I suppose.
Sarah made a point there to add to what you're saying, that marketing and promotion of services may vary in different communities. So that could also be why it can be difficult as well to access certain healthcare community teams. Did I even say that right? And I'm just reading from the chat now. Harvey says, also, once individuals have had one bad experience with one institution, distrust becomes an issue with other institutions. That's true. We do tend to do that as humans, though. We let others suffer for our past experiences sometimes when we're not healed from it. We carry that trauma over, don't we?
Yeah, definitely. I think that when it comes to the way that people, personal family experience, even with sort of mental health and being afraid that historically, particularly Black male presenting people will go into services that end up in care, end up on medication, and you never sort of see them again. They never re-emerge from psychiatric services. And so if that's the word on the street that, if I go and access services, you're gonna tangle, like create some type of web of conversation that ends with you labeling me as crazy, ends up with me on a medication where I don't feel myself and I don't feel able to advocate, and now I'm in the system. This is a true story. This is these are true narratives that come out of our communities. It's how people feel about it. We've not moved forward from this. This is still very much a feeling. And if that's the outcome people are expecting, of course they're not going to engage with services. Of course they're not going to risk becoming just another statistic, because they've seen it happen. They've seen it happen, that they emerge just like in the prison system. You engage in the prison system and that becomes your new life. You end up in a cycle of having this relationship with the prison system. So same thing with mental health services. You know, that is a stigma, that is a belief of what may happen. And I think that people just need to have more information around what mental health services can look like. Talking therapies are not, you know, psychiatric interventions that can result in people being locked away. It's very different. You know, we talk about talking therapies. They're called talking therapies because they're talking therapies. So you're having a conversation, as opposed to being locked away in sort of the old idea of like an asylum where you're in a straitjacket and you're being heavily medicated and you've lost touch with your family. Trigger warning. So, you know, we need to really be educating and having conversations to just help people differentiate between the different types of mental health services, so that we know how many other options are existing and people can feel more safe engaging with that.
Yeah, and to add to that, I think we've also like come from a generation where like we're somewhere like in between, where the previous generation, they probably weren't aware of something called mental health, and like you said, they automatically connected to, you know, you're being admitted to an asylum and, you know, things like that, and people labeling you as crazy. And they for all I know, my parents might have had some mental health issues, but, you know, they're not telling it out because, you know, they think that okay, that is what it is, and their only solution to everything is ignore it. It's all in your head. Ignore it. It's going to be fine. You know, so that's what even they've been exposed to all along, and that's what they think is how things have to be. And I think we are, you know, stuck in that generation where we were trying to like, you know, find our voice and trying to, I mean, I wouldn't say find our voice. I truly believe that everybody has a voice, and we just need to feel empowered to be, you know, able to use that. And like you said, that's where like the community comes in play, where like everyone is together and they're empowering each other, and then they like you are able to, you know, your voice is heard then. And, you know, we are in that kind of a situation where we are struggling to do that and trying to like break the chains and, you know, just break all of the generational cycle that's been like, you know, coming around, and try to sort of like, you know, create a better future for the following generation and for us as well. So it is a big struggle. I mean, at least personally for me, it's a big struggle. Like every day is a struggle. But I think the thing that keeps me going is thinking that okay, fine, in the long run, what is the big picture? What am I focusing on? I will be creating like I'm doing this for the community. I am doing this so that, you know, they feel safe. We are the voice, like we are fighting for them, and that makes me feel good in a way, you know. It's like, you know, I am making the world a better place in some way, you know that. So it's just I think that's something that keeps me going, like trying to think of what your goal is and why you're doing what you're doing, you know. So I think that's like really important.
Thank you. Sarah? Oh, Sarah, I think you're muted.
Harvey and I were thinking identically here as I was listening to Sowmya talk about the labeling that people might feel that they want to shy away from, that may cause them to have reluctance to seeking services, and how it may perpetuate things in life going forward. And so it's kind of like that toss up, and even in the physical health realm, you know, it's like, no, we need you to put a label on something so that we can take care of it. If we don't have a name for something, then we attribute it to, oh, he's just kind of, you know, oh, he's just a little fun, you know, whatever the case is. If we don't put a label on something, say, okay, this is a particular condition and these are the steps to take care of it. So sometimes there's that reluctance. And then on the flip side, sometimes some medical professionals might be overly quick to label things, especially with children, whether ADHD, autism, and things like that. They may be a little hasty at putting labels. And so it's kind of that push and pull of how do we address things and not ignore them, but also make sure that individuals are not overusing that labeling system to classify people and ostracize them in certain ways.
Yes, ma'am. Thank you.
Good point.
Harvey, I was just about to pick on you. You wrote in the chat there. I'll read it again. There's controversy for some around the use of the term mental health. And take it from there, as Sarah was saying, sorry.
Yeah, so again, that's the label, just bounces right off of what Sarah was saying, is that when you start speaking about mental health, for some people that can sometimes have a triggering or a sort of negative connotation around it. But when we talk about sort of mental well-being, maybe that's an alternative that we tend to try and use. So even using things like mental health and well-being as well, it's not always accessible by everyone, only because of depending on what their experience might have been. So thinking of alternative ways to avoid labels, use language that people are actually using with you. I've got low mood, right? So we're talking about low mood, okay? We're not talking about a mental health issue. We're talking about low mood. We're talking about I'm feeling a bit down, okay? Well, we're talking in the terms of feeling down, as opposed to saying, so it sounds like you're having compacted, whatever the term is. We want to make things clinical. We want to make them, because it says from the drop down menu, I've got to select depression. So is it okay if I just put depression? It wasn't what I told you, but okay, nor have you done an evaluation that suggests that I might be depressed, but okay, so we need to be thinking outside of the box of the drop-down list, thinking about using people's terminology, the way that they refer to how they're feeling, and leave it at that, because I think that would help to fight stigma as well. I think there's a bit of a conversation around that.
Thank you. We have another question, and I'll leave this as the last one due to time. But what is the recommendation towards antidepressants, which are effective in terms of body reaction?
I think that's a question for Sarah, maybe.
Take it. Who can take it? Take it. Sarah.
Yeah, so from a physical health perspective, there are benefits to using medications in conjunction with the behavioral therapy, the talking, the counseling, the therapies like that. So yes, there are side effects, which is why, of course, you should always take medication as prescribed from your provider, because sometimes these medications, especially whether it's antipsychotics, antidepressants, things like that, they can have other side effects, and it's about weighing out the risk benefits of taking those particular medications. Some of them have other physical side effects that people have to be aware of. So for example, there's a medication that is actually a smoking cessation. It's to help you stop smoking. But one of the side effects is that it can help with depression too, or cause some mental health effects. So it's kind of like, okay, I just want to stop smoking, but do I want to have all these other manifestations? So, it's something that you have to talk to your doctor about and work with them. But for very severe cases, I'm sure that, the provider might say, this outweighs the risks, and will continue to monitor you to make sure that, any other side effects you might have are manageable.
When you said that, I couldn't help but giggle in the back of my mind, because there's always those commercials that say, yeah, such and such clear for sinus relief, however, may cause thoughts of suicide. I'm like, excuse me, is it worth it?
But I think, it's also, even with hormone treatments, hormone replacement therapies, it's not like a dosage and it works. You really have to navigate the dosages, because your body will react to it depending on what that dosage is. So, it might be a typical thing for a certain person of a certain height and weight to have this particular dosage. But you do need to just communicate that back and say, could we maybe turn it up a tiny bit, or could we just turn it down a tiny bit and adjust that until it's right for me? And so, they definitely work. But I think we have to be really wise in how we have to be really forthcoming with our GPs, with our providers, our practitioners, to say, I'm sure this is going to work really well, but it's not quite where it needs to be. Can we have a conversation about modifying that? And anyone who's received any degree of proper training will be familiar with that request. But I think we're not in the habit of asking those questions.
And Sarah adds right on the back of that, it's also important not to stop the medication without consulting with the provider, so the person can taper off slowly. Absolutely. And with that, I'm going to end it there. And I want to say thank you to all our panelists. Thank you for Kitty for organizing this. Thank you to all of our attendees tonight. And for more information, visit our website at www.blackbeetlehealth.co.uk to access our mental health resources and for signposting your mental health needs across the UK. Thank you, and